Enrollment for Obamacare is underway. Joining me now is Teri Dreher, and she is the CEO of North Shore Patient Advocates. Good to have you back on our show.
Thank you, Angie. It's good to be back.
There are some changes coming to Obamacare and the exchanges. So what are some of those changes?
Definitely. The hottest new topic lately is that prices are going way, way up on the individual programs, both on the marketplace and the individual off-marketplace plans. We're talking about somewhere between 40 and 50% price increases. Yes. Now, of course, people that do qualify for the exchanges and are getting federal subsidies will likely not see that entire price increase, but the prices are going up more. Actually, in the beginning, when Obamacare came out, people really didn't know, the major insurers, what the market would bear, really. And right now, they feel that they're getting a more accurate view of how much it costs to insure all these people.
And so they're hiking prices.
Sure.
Is there any way to fight this? Is there any way around that?
Not really. When the costs of healthcare go up and the costs of all the outflow go out, there's simply no choice. The big insurers do have to charge more. And so they've been losing millions and millions of dollars, and more of the major insurers have been leaving the marketplace. And so right now we had 4 drop out this year. The latest big one was Aetna and Humana. We're trying to have a merger, and that fell through. The federal government said no to the merger, and so now Aetna is leaving Illinois.
Was that out of spite?
No, I don't think so. I think Blue Cross Blue Shield lost $480 million last year.
Why are all these insurance companies losing so much money?
Well, they didn't really understand how many people were going to be using the insurance. So it's not out of spite at all. It's just that they didn't anticipate that the new insurers, the supposedly healthy ones, would be utilizing healthcare as much as they are. And of course, the cost of healthcare continues to rise at approximately 5.3%.
So there are more people using Obamacare than anticipated?
Well, the good news is that fewer people are uninsured in our country than ever before. It's down to 8.6%, which is less than any time in American history. So more people are getting access to healthcare.
It seems, though, if more people are using Obamacare, it would actually drive down the price because just by supply and demand, but that's not what's happening.
Well, that was the original theory, but there are a lot of things in the Affordable Care Act era of insurance that they tried, they experimented with, and now we're finding out that it's a lot more costly than they thought.
How does this all affect the economy?
Well, that combined with the elections this year, there's a lot of volatility in the market, and anybody that says they know what's going to happen are just guessing right now. But we believe that there are going to be a lot of price adjustments this year. There are going to be narrower networks than ever before, and people are going to have to shop around. Consumers are going to have to become really well informed.
Fortunately, there are people who can help you, though.
Absolutely. We're getting a lot of calls from people that are scared to death that Aetna is going out of the Illinois marketplace right now and leaving Illinois, and they're in the middle of treatment with, just like last year when Blue Cross Blue Shield left PPO, a lot of the major hospitals had patients that were undergoing treatment, and they were scared to death. And so we were getting a lot of phone calls about that.
Wasn't there one insurance giant that actually joined the exchanges recently?
Cigna, but that's mostly local in Chicago area. There are fewer. I think 4 dropped out of Illinois. So what we're seeing is that insurance co-ops are growing larger and larger to keep financial sustainability because they're losing so much money. So Land of Lincoln, which was hot last year in Illinois, went out as of September 30th.
That was a problematic situation, though. That was beyond just Obamacare, if you ask me.
Yeah.
Full disclosure, I had Land of Lincoln. Harkin also dropping out. What's the reasoning there?
Harkin, I think, just looked at the numbers and said we can't compete. We can't make a profitable go of it. And even Blue Cross Blue Shield, which has a major share of the market, they have about probably 3/4 of the market in Illinois. They are still trying all kinds of things so that they can become profitable. Last year they lost $480 million. So,
is this a bad sign for Obamacare?
Oh, that's a loaded question because there's so much about the election that we don't know too. But I think eventually the pendulum will swing back, but we're still in the early years and it's taking a lot longer than anybody realized to stabilize.
Good to know. Thanks for coming on the show.
Thank you. Thank you so much, Angie.